So there is a lot going on from a research side in the treatment of small cell lung cancer. And it's horrifying that anyone has to be in a situation where they need these treatments. But academically, it's exciting to see such advances in these treatments. In the limited stage space, we now have the incorporation of immunotherapy after chemo and radiation. So this is limited stage where we're treating with a goal of cure. The standard of care up to this point had been chemotherapy and radiation and then monitoring. And what we've found is that by adding 2 years of immunotherapy, that's a 30-minute infusion once every 4 weeks for 2 years, most patients don't really end up with a lot of side effects. This is something that's pretty well tolerated. That with that, we see improvement in the time to recurrence. I would speculate in saying actually the number of patients cured, and we need longer term before we start using these words in a scientific way, but what it looks like is that we may actually see an increase in number of patients cured, which is of course the real goal in this, and that overall people live substantially longer. And so overall this has been a very good signal for how effective the drug is, while also does not have the same kind of side effects that we see from chemotherapy. This has been a huge advance in metastatic stage 4 and now also in the earlier stage curative setting. In the metastatic setting or stage 4, incorporation of immunotherapy has been an important part of the standard of care at this point for 7 or 8 years. But we have so much more going on now also. We have like a targeted chemotherapy we call antibody-drug conjugates. This is essentially an antibody is something that kind of finds, we think of it like, maybe like a key that finds the lock somewhere, and that's how it opens a door to deliver the chemotherapy. And there are multiple drugs in development that are showing some very promising results, really working for a substantial number of patients in the later lines of therapy when first-line treatment reliably works. It works great for the majority of people. But as people get further along, some of the classic chemotherapy drugs, they can work, but these work better. And so it's exciting to see those advances happen. Of course, we also have immunotherapy in tarlatamab. This is a drug that grabs the tumor cells by a receptor called DLL3, grabs the immune cells by a receptor called CD3, essentially bringing the immune cells and tumor cells together to create more of an immune response. And this has worked remarkably well, and this is now the established second-line treatment for patients and something that has shown some very promising results, particularly in that we're seeing some patients years on where they're having ongoing disease control in that second-line setting.